What's up, everybody? This is Megan.
And this is Bobby K.
Welcome to the Addictionary, the podcast that brings you
an unconventional and uncensored take on things like
addiction, recovery, holistic health, and more.
Well, I told myself to not give in to you, and I told myself I can't afford to lose. But here we are again, looking, wishing for some truth. Hey yo, I can't explain it. For more than 10 years, it's been the same shit. This love and hate thing starting to be mentally draining. Entangled in your web of destruction, it's disgusting. I've had enough of it, and still you be tempting me daily. Never figured I'd end up with somebody like you. I try to follow the rules and even study for school, but now I'm falling for your cheap tricks. You like my cheap fix, I'll give you anything you want. Just take me higher than a G6.
What's up, guys, and welcome to our show this week. We have an outstanding guest that we are chatting with today, and we will get to that in just a minute. But first, give us a follow on Instagram. It's at The Addictionary Podcast. If you like the show, find us on iTunes and leave us a 5-star review and a comment. And visit our website. It's www.theaddictionarypodcast.com. There you can find all of our episodes and the leave a voicemail button, which you can click on if you want to leave us up to a 5-minute voicemail of your story or any questions and comments that you want to send to BK and I, and we will play it on the show. Okay, so let's cut to the chase and get to our guest for this episode. Today, I am chatting with Adam Lundquist, who is the Director of Admissions for Road to Recovery Treatment Center in Fort Lauderdale, Florida, which is the only drug treatment center in Florida that accepts patients using medical marijuana. So, Adam joins my friend Liz Jalen and I. She's from episode 7, if you guys want to go back and listen. Liz was so kind to invite me to her house to do this episode, actually outside in her backyard. And it was just a full love fest. It was like a meeting of the minds outside of a meeting about harm reduction and addiction and recovery and cannabis. And it was just one of the most thrilling, if not the most thrilling conversation that I have actually ever had, especially about the subject. I literally left feeling like this was by far the best conversation we have ever had on the podcast, and I still believe that. So go to roadtorecoverytreatmentcenter.com to find out more information about how Adam and his team can help you. And don't forget, leave us an iTunes review if you like the show. All right, let's get chatting with Adam here with my friend Liz on this beautiful Monday afternoon. Hey, Adam, thanks so much for calling into the show. I am really excited to chat with you tonight, as Liz is as well, right, Liz?
Yes, I am. Thank you so much, Adam.
And we want to first say thank you for taking the time to call into the show. I know you're going to share a little bit about what you do and your inspiration for doing it, but we're excited to have you. Thanks for being here.
Well, thank you for having me here. So, just a quick introduction. I am Adam Lundquist. I'm the Director of Admissions at Road to Recovery Treatment Center, also one of the founding partners. What we're doing over here is it's pretty interesting. So, we are the first center in Florida to accept clients on medical marijuana, and we've implemented a lot of medical marijuana protocols to our medical approach to what we're doing here.
Nice.
Uh-huh.
Okay, so let's unpack this for folks. So what part of Florida are you in?
We are in downtown Fort Lauderdale,
okay,
which is southeast Florida.
Awesome. Yeah, I was there a couple years ago. Were you guys up and running then?
We actually just started this past December.
Okay, cool.
Yeah.
All right, so now I know about 2 other treatment facilities, this is why I'm so thrilled to hear that there's more people using this model, because I think it's so valuable. I wish, right, if we could have it in Massachusetts, how awesome would that be?
It's super needed.
Yeah, super needed. And I feel like Massachusetts needs to get up to speed as to the clinical utility and the therapeutic value of cannabis, particularly in treating other substance use disorders. So how did you guys come up with the idea to do this? And what was your familiarity with cannabis up until that point?
Well, to be honest, it was God moment after God moment that brought this whole thing together. So the partners that I've aligned myself with on this, we all met through mutual friends and started kicking around ideas of what it was that we needed when we were in early recovery. And even amongst my partners right now, when the conversation first came out, it was kind of like, well, hey, I smoke pot too, but don't tell anyone. And there was just this aura of guilt and shame that was surrounded around medical marijuana use in recovery. And I was the first one with my partners to say, you know what, I use it, and it is strongly impacted my life in a positive way. I actually remember I put up my first Facebook post going public about it. It was with a handful of medications in one hand that I've discontinued, and then in the other hand, 2 bottles of sublingual drops with THC in them that replaced the medications. And I got an overwhelming amount of responses to it. Some good, some bad. A lot of people in recovery were I can't believe you're saying this. You have a lot of people that look up to you, and you're promoting active addiction. You should be ashamed of yourself. From that end of the spectrum all the way over to I actually even had a few of the techs that were techs at the treatment center I went to reach out to me and said, you know what, man, I'm not ready to come out public about my usage with it, but thank you for doing that. Thank you, because I've been doing it too. And just so many people that I've found in the recovery community are living in this sense of guilt and shame, and fear of rejection from the recovery community for being able to come out about their use of medical marijuana.
Man, I mean, it's just like gives me chills, right? Doesn't it?
Yeah, it brings me back to the reason why I left my job.
Exactly. And this is, and like Adam's like telling my story right now because this literally was my experience. And then I decided that I could take the opportunity as a doctoral student to focus my studies on how and why cannabis is doing this for folks where they're terminating their opioid use as a result of implementing CBD and or the full plant. And I just became so fascinated by it because there was a period in my recovery where I think cravings started to come back into play, and I wasn't really prepared to handle them. And it felt like they came out of nowhere. Obviously, nothing comes out of nowhere now in retrospect. But at the time, it was sort of like, whoa, I'm treading into an area here cognitively that I haven't been yet in my recovery, and started to get a little nervous about it and was like, okay, what am I going to do? And I knew someone who was using cannabis and had stopped all their opioid medications and their problematic use with fentanyl patches and that sort of thing with cannabis. And I was like, there's got to be something to this. And so I explored it myself and then was like, you know what? I'm going to start a podcast and I'm going to talk about all of my, all of my personal experiences, and this being one of them. Because like you're saying, there are so many people that are dark and in the shadows because of the shame, but are using cannabis and experiencing its benefits, but can't feel like they can say it publicly or don't want to or what have you. And I wanted to be someone that sacrificed myself as a way to provide a voice to the people that didn't have platforms to say this. And it's been incredible, the response that I've had just by having this podcast and the people reaching out to me and saying, yeah, I can't say it, but I'm so happy that you are representing this voice. I mean, you must feel the same way.
Absolutely. I've had people that are still working in recovery jobs that have reached out to me and said the same thing and just said like, hey man, thank you. Someone had to do it. I'm not ready to, but thank you. And like I said, the responses have been overwhelming, and from one end completely to the other. Like I said, some people messaging me saying that I should be ashamed of myself, and then other people saying thank you for doing it. I can't wait till I have the courage to be able to come out.
Yeah.
And speak about it.
Yeah.
So it's been a very overwhelming response, and honestly, when I first got into recovery, I was all for the absolute abstinence, and like you said, I hit a very dark patch around 1 year. For my personal story, it didn't make sense how people would come down and 30 days later end up relapsing. So I always told myself, I said, you know what, I've got at least a year in me. Once I get to, that's what they talk about is your first year. Once I get to my 1 year, I'll be okay. No matter what, I'll push through. I'll get it. I'll get my 1 year. And when I got my 1 year, now I really hadn't implemented any program of self-work. I was what they refer to as dry drunk. I stopped doing heroin, but I didn't start a program of self-work. I changed the people that I was around, but I wasn't receptive to the self-change. So I hit a really dark patch because I figured I was going to hit 1 year and miraculously everything would be okay and everything was going to be better, and it wasn't. So my craving started going very high. I was starting to regress emotionally and mentally. And one of the conversations I was having with my sister, who's a huge marijuana advocate, she's really big into holistic healing and herbalism. And, she said to me, she said, Adam, back when you would try to get clean, you would just smoke pot and everything was going good. Have you ever thought about exploring that again, especially with all of the advancements with the medical marijuana? It's not buying pot off the street. It's a completely different medical approach. Have you thought about looking into that again? So I started exploring and, looking into the different CBD products, which I'll warn everyone right now, stay away from the gas station CBDs.
Yeah.
It's not CBD.
Big time. I've had multiple conversations just in the past 2 weeks about this. I'm like, you guys, send me a picture of your bottle. They send me a picture. I'm like, no, stop. Like, what? No.
Yeah.
Reputable places.
And I was very very fearful stepping into it. Because of I had done my first year of recovery through the 12 steps and the program of AA and NA of absolute abstinence. And if you pick up one time, you've thrown away all your clean time. And you might as well start over.
Yep. Very damaging message, by the way. I'm pro AA in a lot of ways. I didn't utilize it myself. That to me is one of the most harmful messages that I think causes more harm than it does good.
Listen, I'm a big harm reductionist, and I will tell you right now, I love the 12 steps. The 12 steps are absolutely phenomenal. I think they've helped more people than just about anything. But I have a very big problem with a lot of the ways of the program. If somebody has relapsed, you cannot tell me that I've thrown away the last year of my life.
I know.
I may have changed my clean date, but recovery is more than abstinence. Recovery is a way of life. Absolute abstinence, is that what's right for some people? Yeah, for some people it is, but everything's not for everyone. And for myself, medical cannabis provides relief in certain areas that are needed. I was in a motorcycle accident. I broke my back in 4 spots, 9 ribs, collapsed a lung, broke a wrist. The list goes on. So chronic pain is something that I would live with. Now, in my journey of absolute abstinence, it was waking up in excruciating pain and incredibly miserable because of that, and white knuckling my way through not having a relapse. Today with medical cannabis, I'm able to medicate at night with that, and I can get a good night's sleep and actually rest and not have my back bother me the next morning, which has dramatically improved the quality of my life. And that's just one area.
Speaking of which, I did want to ask you, because I've talked to a few different people now on the show and really trying to get an understanding of people's subjective experiences with using cannabis to abstain from opioid use or to reduce opioid use. And there's sort of like a theme that's emerging with the people that I have spoken to, which is this idea of cognitive enhancement, which in the literature really just means an improved function in your cognition, whether that's increased in speed, in the ways in which the neurons are firing, or provides a clarity, almost like a bird's eye view to your decision-making process. And so they're kind of assessing their opioid craving that they now don't have because they've smoked or utilized cannabis, and now they're looking at their thought process and saying, nah, I don't know, I don't actually want to do that, and they're refraining, and that seems to be the theme that's emerging. So I didn't know for you, from a psychological standpoint, how it impacts your decision making or your thought process, or how it helps you in that way stay away from more harmful substances.
Well, there's several ways. One, I'm really big on the Delta 8 strain. I'm not sure if you're familiar with that. It's not as much of a euphoric or head high as it is a relaxing real body high, relaxes the muscles, really dulls pain. So chronic pain was one of my large precursors to relapse every time. So that's one that really helps. Now, also as well, when I do medicate, a lot of times I'll go into a deeper thought process. And as I'm processing my thoughts and doing my self-inventory and looking at things, it allows me to look a little deeper into things and truly be able to rationalize and look through the process of, this isn't something that I want to do, especially when I'm having those craving moments and thinking about using.
Yeah, powerful. Elizabeth, for you, how do you answer that question? What does it do for you in that capacity?
For me, I also suffer from chronic pain. I have MS. I've had multiple surgeries. I have 2 steel rods in my back. And my precursor was a lot of the time I'd go back out because of the pain.
Yeah.
And I didn't know how. I looked at heroin and marijuana the same way. Like, so messed up.
As at one point you demonized
Oh
both
my
equally.
gosh.
Yeah.
Oh yeah, they were
Yeah,
both
yeah.
evil. I mean, in coming out of AA and NA, like abstinence was the way. So I didn't remember using cannabis and having my pain go away. So I never went back to smoking marijuana.
Right.
Or using marijuana. I always would relapse and go back to what I knew.
Right.
And then when last year when I was lost. I didn't know what to do. I had just gone through another surgery. Because of my MS, like I lost half my teeth in an abusive relationship too. So I had to have surgery, and I didn't want to use any opiates. And my sister, who never went into addiction, used marijuana the whole entire time. And she was like, well, why don't you try doing this? And she got me some edibles. And when I tell you, like, I wanted to die, and then just this relief came over my body. And I was like, holy crap. Like, it was the thing that I was missing.
Yeah, I
And
agree. I
been-
identify with that too.
Yeah, and with like high levels of psychiatric meds on top of everything
Yep.
else, I finally was able to walk away from those 7 months ago.
Wow. See, this is the stuff that's really like life-changing for folks. Like this is totally different from the DARE era, and this is your brain, and this is your brain on drugs, and marijuana is one of those drugs. I think we're starting to see what I would refer to as a shift in the collective consciousness here about the social perception of cannabis, in that we are now finally being able to see the truth as to what it can actually do from a therapeutic value. And I think it's taken a long time and a lot of corrupt politics that's prevented us from researching and putting in the literature what we as the users already know. But I think now we're starting to see the catch-up happening, and my hope is that people can really start to listen to stories like ours. And Adam, back to you were saying about sort of a different type of thought process, if I'm saying that right. More clarity and maybe like an expansive level of thought. Like that to me is incredibly valuable in solving the world's problems, as cheesy as that sounds.
And no, you're absolutely right. And a few more things that I want to touch on. Whenever I talk to anyone about the medical marijuana program, so they're like, so are you listening to Bob Marley and rolling joints?
Yeah, I know. Everyone, that's everyone's reaction.
and while I absolutely do like Bob Marley, I have to explain to them, no, that's not the process. And what you were just describing it's a conversation that I have regularly, and I have to tell, because when I'm talking to parents, most of them are the parents are the children of the reefer madness generation, and where marijuana was very demonized, and it was compared to the same thing as using heroin or cocaine or methamphetamine or any other drug for that matter. So much so that it was labeled a scheduled narcotic with no medical value. Where we're at right now is, and that's why I say to people all the time, is this isn't your granddaddy's weed. You're not buying this off the street, and they named it, Purple Kush Strawberry Granddaddy Perp, just so that way you'll get some more sales on it. You're going after, while the names are still a little crazy, you're going after specific strains with specific characteristics, and each one of them allows the client even to have say on their medical protocols.
I love
and,
it.
You know, what works for me isn't always going to work for the other person. And I can be able to have a voice in my own recovery. I can have a voice in my own medication regimen. Like you heard me say before, the Delta 8 strain, it's a phenomenal one. For me, for my physical pain, it's absolutely great. Now, one of my partners, he has, bipolar mania, and when he gets manic, it's a very clear thing, and everybody knows it. And he's up and he's down, and he was on mood stabilizers. Now, one of the things that helped him more than anything is the RSO ratio pills, which is 25 milligrams of Rick Simpson oil and 25 milligrams of CBD in a pill, which he takes orally every morning. And when he takes that, it's just a very calm, cool, collected, level-headed mood stabilizer for him. And it works absolutely phenomenal.
That's incredible. I know very little about Rick Simpson oil. I know more about CBD oil and maybe just the THC oil than I do the RSO. But everyone always says that's where it's at.
So
it was too strong for me to do any more research on.
No more research on yourself.
had 2 tumors on my cervix.
Yep.
And took Rick Simpson oil as prescribed. And also my levels for Hep C last year were astronomical. And when I started using marijuana and like CBD and the Rick Simpson oil.
Yep.
So I was going to do the Harvoni.
Yep.
In my last labs, there was no tumors. They were gone. And my Hep C, there was no trace of anything in my body.
Come on.
Wow.
Is that not wild? Like, and who?
I would never. And my doctor even asked me, "What did you do?"
See, that's funny because when my dad was doing his alternative medicine with the functional medicine doctor and doing the chelation and the ozone and the vitamin C drips and the whole bit for his Hep C, and his levels became undetectable, he went back to, I'm not going to say the name, but one of the leading hospitals in Boston, to the liver transplant team. They saw the levels were undetectable, and he literally said to the doctor, "Aren't you interested in what I'm doing?" And they said, "No, that is not the research we do here."
What?
So good for your doctor for even being interested in this.
My doctor is amazing. Like I tell him that's a huge part. I think this time around for me staying in the path of recovery is that I was able to be honest with my family and my doctors. Every single one of my doctors knows that I use cannabis.
Wow.
Like, the only thing I am afraid of is if I ever have to go into the hospital for like another surgery or for anything because of my MS, because I can't bring in anything. That's the biggest fear I have.
Adam, what are your thoughts about that? As somebody, so what was your drug of choice, by the way, if I may ask?
Heroin, but you can't have peanut butter without jelly, so cocaine as well.
Yes. All right, so same. So, well, not really the cocaine. The cocaine came first, and then I gave that up, and it went right to the oxys and the dope, which was like, the toxic relationship of the lover that never left, that needed to go a long time sooner than they did. Now, what are your thoughts about being someone, say, recovered or in recovery from opioid use, who utilizes cannabis now and going in for surgeries, and would you take the opioid prescription? Would you
Not a chance.
And how would you have the conversation in which you would advocate against that, and what would you use instead? Probably just more cannabis, but.
Yes. So, and that's, from my experience now, God willing, I won't have to go through any surgeries, and I haven't gone through any since my recovery. But I found the absolute most dangerous thing about marijuana is the stigma around it.
Yeah.
And that's it. And the way we break the stigmas is with open conversations. I would hope that if I do have to have a surgery, I can have that honest conversation with my surgeon or my medical team and be able to express to them. And hopefully they'll be at a point where, as true medical professionals, they're interested in the well-being of the client, and we can have that conversation, and they'll respect my opinion and co-sign what I'm doing. And if they don't, Still, at the end of the day, this is my recovery. The only person that I answer to is God. I certainly take suggestions from anyone else, but no, there's not a chance that with or without surgery, I would take any of the opioid pharmaceuticals.
That's incredible. More power to you on that, because again, I say very, very, very similar things, and I always sort of say, like, my recovery is my recovery. Like, the only person I answer to is me. That's it. So if you have an opinion about the fact that I have a podcast and I'm not being responsible because I'm not funneling people into the AA program, because I should be doing that, and how dare I say I'm in recovery if I use cannabis, and these are like word for word people who I thought were friends that said this to me. You know, that is your problem, not mine. Like, what you think about me is none of my business. I am thriving in my life. I'm on track to be a doctor in 2 years. I think the evidence can speak for itself. And I think if marijuana was as bad as you want us to believe it is, there's no possible way I'd be doing what I'm doing. So let's stick to the facts.
Well, and to further off that, let's do that. Let's stick to the facts. You know, in the 1930s, when AA and the 12 steps were formulated and brought together, I was reading an article that said that the success rate was rated at 50%, making it to a year, with 75% of all relapses coming back within the first year. Today, SAMHSA puts that at a 3 to 5% success rate, making it past the first year. We're using primitive technology to treat a modern problem and expecting the same results, and that's an issue. Just like addiction is ever evolving, as should be the treatments.
So,
Baby, we're
could
on
you walk
fire
us
tonight.
through a day at your facility?
Say that again, Elizabeth.
Could you walk us through a day in your facility? Like
Absolutely.
So when a client arrives, what happens?
Okay, so when a client first arrives here, they're going to go in, they're going to do their biopsychosocial, they're going to sit with the master level clinician to be able to dig in and find out the whole history of the client. It's an extensive process. I know I've done one. I know, Liz, you've done one.
Oh, yeah.
It's pretty in-depth. Now, from the medical side of it, what we have is we have a doctor of integrative medicine who's going to be sitting with each and every client. They take 23 different blood samples. It feels like it's half your blood. And they're checking for every single deficiency that could be going on internally, from hormones to chemistry to your lipids to your adrenals, seeing what's not balanced internally. Example, myself, when I came into early recovery, I had extremely, extremely low energy, which would cause me to isolate, which is furthering my depression. Then I'm drinking 3, 4, 5 Red Bulls throughout the day so I can get up and go do something, which is negatively affecting my adrenals, which is heightening my startle sense and heightening my anxiety. So untreated, you have an addict in early recovery who's furthering his depression and furthering his anxiety. My diet consisted mostly of Haribo gummy bears, Newports, as much heroin as I could get. No wonder things are a little out of whack internally.
Go figure.
And what was the issue but low B vitamin and low iron. So we're paired with a compounding pharmacy to be able to make a supplement specific to the client based off of the deficiencies that are going on internally, with the end goal of working towards having the body closer to where it should be prior to drug usage.
Oh my God. Okay, hold on.
Yep.
Time out. Because like 2 weeks ago, I said to my dad, because my dad is all about, my dad hosts the show with me. In fact, everyone that's listening is going to be like, where the hell's Bobby? Because he's been like off all summer. I've been doing interviews with everyone just on my own. Anyway, he's doing construction on his house, but when he's done, he's coming back on. We're going to get rolling, and we're going to be talking about all the things that we've been talking about off air all summer. And one of the things he's been capitalizing on every time we talk about this stuff is personalized medicine. And I literally said to him 2 weeks ago, I was like,
infusions.
Yeah, the infusions for one, and also
The
this.
NAD therapy.
Yeah, the NAD therapy. We're actually having someone else come back on the show to talk about that in their treatment
Phenomenal.
center. Incredible. And I said I am going to devise a system in which I assess people's vitamin deficiency levels, and I'm going to make customizable multis for them, and I'm going to give them all of the amino acids and all of the stuff that I think they need in one pill. And now you're saying that you do this at your treatment center. This is freaking phenomenal. I'm just like, so you guys use like a functional medicine modality? Okay.
So yeah, Dr. Edward Pearson, he's a doctor of integrative medicine. I swear the guy's a magician. Um, after starting the regimen with him, it's just, it's not about what you feel, it's about what you don't feel. I don't feel sluggish throughout the day. I don't feel low energy. I feel just a sense of happiness. Just everything internally feels balanced and truly able to go about my day in a normal way.
Wow.
Hmm.
So,
So,
yeah, so you, okay, I have some other thoughts, but go ahead, continue.
hmm so that's part of the medical approach. And then, like I said, we have master level clinicians to be able to sit with each one of the clients to work on the underlying issues of addiction, whether it be the past trauma, depression, whatever the barriers to treatment could be. Um, then as well, I mean, you have the acupuncture, or the massage, the chiropractic services, which is something that absolutely helps someone like me, who chronic pain was one of my big precursors to relapse. So that's definitely a little added bonus, something that I like. And then as well, so I covered the medical, I covered the clinical, and what was I just going to say?
I was gonna say, what about
Yeah.
does someone, does
The
a cannabis
cannabis. The
doctor?
cannabis.
Yeah,
Absolutely.
the obvious one out of all of those.
Yes. So when we're talking about opiate withdrawal, we're talking about depression, we're talking about anxiety, we're talking about muscle soreness, lack of appetite. Um, the list goes on of all your post-acute withdrawal syndrome. Now, that list that I just described right there is also, it could be taken two ways. That is a list of post-acute withdrawal syndrome, or that is a list of symptoms alleviated by medical cannabis. So the medical cannabis is really truly helping to relieve a lot of the post-acute withdrawal syndrome. Now, in Florida, opioid use disorder is not a qualifying condition for medical marijuana. But the clients are experiencing other ways that they are qualifying through it, whether it be through post-traumatic stress disorder, whether it be through chronic pain. Um, but that's something that we do hope to see change in the future. I know New Jersey, New York, Pennsylvania, they've been a little more progressive with it.
Yep.
And they've actually added opioid use disorder as one of the qualifying conditions for medical marijuana. So
Yep.
that's definitely a change we hope to see here in Florida.
Yeah, definitely. I actually remember reading the news alert when New York made that decision, and I was like, "Oh wow, we're moving and grooving here." So,
Oh, even on top of that, there was a man in New Jersey who ended up suing his insurance company to cover the costs of his medical marijuana, and a judge ruled in his favor. So hopefully, once the federal decriminalization happens, and hopefully that happens by the 2020 election, we can start to see some insurance coverage for the medical cannabis, because right now it's a cash only business.
yeah,
And the population that we're dealing with, opioid addicts, they're not coming into treatment with money.
yeah,
So we're reaching out, we're getting family support, but they've lived a lifestyle that's already been such a financial strain on the family. It would be nice to start to see some compensation as it is in medication.
absolutely. Fantastic points, by the way, Adam. I love that. I think it's so true. I had a question about what kind of intake assessment or what have you, or whether it's just an interview with the cannabis doc when a patient arrives, but how do you kind of figure out what the clinical and medical needs are, and then how do you match your strains to that, and then how does it work? Do you guys, you guys must not be able to provide the marijuana, they must have to get it elsewhere and then come to you guys?
Yeah, unfortunately, we can't provide. But what we do have is a business down here called True Leaf Dispensaries. We've worked closely with a lot of their outreach team and their educational team. So they actually provide a representative on a biweekly basis to come into our center to do strain-specific education, to be able to talk about the different strains available, and the different symptoms that they can alleviate, and what they're good for and what they're not good for, the difference between CBD, CBG, CBN, THC, THCA, and just really run a good educational information section for each one of the clients. Also, they sit with the doctor to be able to talk about their specific needs and what it is that they're looking to be able to alleviate.
Okay.
Mm-hmm.
Now, maybe you already said this, but does your program provide, like, is this outpatient for folks? Or are they coming in for detox? Is it residential? What kind of level of care is it?
So we are a partial hospitalization program, with an acronym for that's PHP, and a intensive outpatient, which is an IOP. You'll hear me refer to them as the acronyms moving forward. The PHP is a 25-hour a week, 7 days a week, with a minimum of 25 hours. So they come to the center at 10 a.m. and they leave at 4 p.m., with an hour lunch break in there. And then the intensive outpatient program. So let me rewind. Actually, 90-day program is what we typically like to see. So that's 30 days of the partial hospitalization program, 30 days of IOP with a frequency of 5 days a week, and 30 days of IOP with a frequency of 3 days a week.
Got it.
Yeah. So then the IOP is 3 hours a day, and the PHP is 5 hours a day.
Okay. Wow, man. Now, and let me just ask you this. So for people that are listening that are in the Fort Lauderdale area or would be interested in going to a program like this and want to contact you and reach out, is there any insurance coverage, or is this out of pocket for the patients that come to your program?
Yes, it is. So we are an out-of-network facility. We do accept most major insurance companies, and that covers the actual clinical services available.
Okay.
The cost to the client is what's not covered by insurance, which is the cannabis portion.
Got it.
So the doctor visit and the medication for the cannabis.
Cool, man. I have one last question, but I want to turn the table over to Elizabeth in case you have any questions. Any thoughts? Anything you want to add?
No, I think I asked all my questions in that last one. I was going to ask how
About insurance?
the insurance and how someone would go about paying.
Yeah.
Do you guys do any scholarships or like any ways, like from donations or from fundraising to help these individuals that can't provide for themselves to get the cannabis?
So we maintain a 25% of our beds are scholarshiped at all times. We're a 52-bed facility. As far as being able to help out with the cannabis, we've actually had Trulieve again. They've made donations to us to be able to offer everything at a reduced price to our clients.
That's awesome.
Wow. And do you guys prescribe Suboxone or Vivitrol, or is it just strictly a cannabis inclusive community, if you will?
Wonderful question. So we are geared specifically towards the chronic relapsers of South Florida. There was a few years back, it became a blanket statement that all treatment centers were now doing buprenorphine maintenance for opioid addicts. That became the standard of, you're an opioid addict, and now you will be on buprenorphine as a maintenance dosage. So our medical team will not take anyone in on a higher dosage than 8 milligrams of buprenorphine. And each person has an individualized treatment program, but they're expected to taper down while they're here, which the medical cannabis is helping phenomenal with. I kind of refer to it as the honeymoon stage, where everyone gets their card and they get their pen and they go, wow, I'm really in treatment and I'm allowed to smoke. And they maybe smoke a little bit too much, which is actually kind of paired up perfect with the treatment plans for the taper, for the buprenorphine. So what they're doing is they're stepping down off the buprenorphine right in that honeymoon stage with the pen, so it's really truly helping to alleviate a lot of the symptoms. They're using a drug called Lucimyra, which works on the alpha A receptor, similar to clonidine, and it's specifically made for stepping down clients off of buprenorphine and transition directly into a Vivitrol shot.
Whoa, man.
Oh yeah,
You're speaking my language here, buddy.
We're getting the chronic relapsers who never stay more than 3 to 5 days in a program or never complete a program, who have been on buprenorphine for the last 1, 2, 3, 4 plus years, to transition off their buprenorphine in a comfortable way between the cannabis and the Lucimyra, and transitioning directly into the Vivitrol, where there is no alternative. When you're on the Vivitrol, I don't care if you give me $1,000 worth of heroin, I can't go get high.
I know, man. I know. I got in trouble for
Trust
saying
me,
that.
I've
I was on.
tried.
Me too. Me too. I was on it for 3.5 years, and I do a lot of work with the pharmaceutical company that makes Vivitrol now, just because I was a former patient. And we talk, and I've shared that story in front of them at their employee town hall meetings and stuff, and like. People get a kick out of it, but I got in trouble one time. I was sitting on a medication-assisted treatment panel, and I was kind of like the Vivitrol person with the Suboxone and the methadone folks, and I said that, and I think the nurse would have chopped my head off if she could have. She's like, "That is not true. You can absolutely break through it with fentanyl." And I was like, "Yeah, but I tried it with a lot of fentanyl, and it didn't work." So,
Well, disclaimer: I'm not a medical professional. I'm just an addict from New Jersey. But I tried multiple times and was never able to.
Yeah.
And that's one of the things one of the reasons we chose to add that as part of the medical protocol here is your chronic relapser is going to have that moment where, you know what, maybe they do go out and use. And when that does happen and they experience that of, well, darn, I'm truly dedicated and forced to having the next 30 days of being opioid free, I guess I might as well make the best of it.
Yep.
And it's a pretty cool thing to have.
I completely agree. It's the exact thing that I say is one of the huge benefits when I was on it, was that exact thing of like, you when that happens, you can go one of two ways. You can accept the fact that you're not getting high and just sort of ride the wave and just see where this is going to take you. And then if you do that, it's then 10 times easier to just show up for the shot than it is to put all the time, effort, and energy into manipulating, canceling appointments, lying, timing it, waiting for it to wear off, and then trying to pass a drug test so the doc doesn't know what happened. And like, all I have to do is actually just show up, get the shot, and then all the work is already done. I don't have to do all that. Like, I'm just gonna roll with it. Or you get the people that are like, no, fuck this. I'm gonna do whatever I can to get high. But and then plan to use and not go back for the shot. But I would say more people are in the former category, and that was me.
One thing I do want to mention real quick too, I want to give a nice shout out to Fifth Street Counseling. They're a nonprofit that's located here in South Florida that actually has the ability, and we work with them closely to provide Vivitrol for any client for free, no cost, for an entire year.
No way.
That's amazing.
Yep, that's been a really, really big help, and I can't thank them enough for that.
Holy moly. You guys are doing phenomenal work. Oh my God.
I have a question about food, though.
Food, yes.
So, what is the diet like for your clients? Is it organically grown? And also, another question after that, do you teach your clients how to grow their own medicine?
Now, that's something that I wish we could do. You guys are a little further advanced than we are. We just got our flower ban lifted, so we're not able to grow yet.
Oh my God.
Yes. Yeah, so one day soon, I hope that we get the same privileges that you guys do. And we would absolutely include something like that. But yeah, just not as of yet. And then what was your other question about?
The diet.
Yeah, so we do have a dietitian that comes in and runs a group with all the clients to speak about a healthy diet. We do have breakfast and lunch catered, and then they do their own cooking at nighttime. But it's up to their discretion. But we do provide, like I said, the education through a dietitian for them to at least have the knowledge of making the healthy decision.
Yeah, right.
Mm-hmm.
Yeah. Oh, I think it's a great point. I think I'm gonna pitch it back to you, Adam, to leave it with any final messages. After I ask this one question, I'm gonna ask it because I have been I've sort of received this critique, and I'm curious to know what your reaction would be if somebody said this to you and did what they did to me, or if you're like, you've gotten this before. So when I'm on the show, I talk about the different pathways to recovery. I have people on the show that cover all of these angles, including Suboxone and methadone. Now, I talk about the dangers of those drugs, and I talk about my resistance to the enthusiasm of the prescribing practices of the medical doctors that I believe are large in part after they were guided and pressured by medical societies and big pharma to prescribe opioids. I am very uncomfortable with putting the power of my own life and my health and my recovery back into those people's hands, okay? And so that is my issue with the Suboxone and methadone, is not that I don't think that people that are on it aren't in real recovery or that they're just trading one drug for another. I think people do really well when they utilize it as medically advised in a responsible fashion with a relatively low dose. I think it's ridiculous the doses that they're prescribing people. And I think the fact that folks don't have an exit strategy upon getting on that medication, knowing how hard it is to get off of it physically, is a travesty. And I think if we believe that pharmaceuticals are going to be the way out of a solution that got us into this problem, I think we're just chasing our tail. And I think, sort of as the big FU to the powers that be that want to push these meds down our throat and stigmatize us by saying meds, long-term maintenance is the only way, just like it's stigmatizing to say AA is the only way, then I have a problem with that message, and I think it sends the wrong message to say that we can't be something beyond that. And I have people say, you're supposed to be open-minded, yet you don't embrace Suboxone and methadone. Like, what's up with that? You're a hypocrite. You're not being open-minded. What are your thoughts on being a harm reduction advocate, cannabis advocate, but having reservations about the ways in which Suboxone and methadone are being dosed and prescribed to people?
All right, you ready for the long answer?
All right, I'm ready.
Well, I'm going to shorten it, then I'm going to go into it.
Okay.
So for the short answer of it is, I am a recovery advocate. And to me, what that means is I support all pathways to recovery. I deal with a lot of people that claim to be recovery advocates, but they are the first ones to say you're doing it wrong if you're doing it differently than them.
Yep.
You know, whether that be the 12-step community, whether that be the medication-assisted treatment community, or whoever it may be. I am a recovery advocate. I believe, you know, recovery is about improving the quality of your life. What are you doing with yourself? What are you here for? Are you finding your purpose? Are you bettering yourself in your life circumstances?
Right.
Do I believe that Suboxone is right for everyone? No. Do I believe that it's right for some? Absolutely. Everything is not for everyone. And a lot of people ask me about, you know, the medical marijuana, and that's one of my statements that I find myself using the most, is everything is not for everyone. Some people, they take one hit off of a marijuana pen, and then 10 minutes later they have a needle in their neck.
Right.
I believe a lot of that is due to the brainwashing of the program, at least with telling them, like, listen, you've already relapsed, so what's the point in relapsing if I'm not going to go enjoy it? I might as well go do what I want to do.
Yep.
But that's my personal opinion on that part of it. But everything isn't for everyone. And when you have the chronic relapser who can't keep a needle out of his arm, I'm never going to get a chance to talk to him about recovery. I'm never going to get a chance to talk to him about having a better life if he's dead. So the harm reductionist in me would say, you know, everything's not for everyone, and I understand that. But your client that has, you know, 10, 15, 20 episodes of overdose in the past year, which I know those numbers are alarmingly high, but I come across them.
Yep.
Or 10, 15, 20 episodes of detox within the past year. And you say, how does that happen? I come across them. And I see it often. And the person like that just can't keep the needle out of his arm, is being on Suboxone better than being dead? Absolutely. I don't care who it is, medical professional or anyone with a tiny bit of common sense. Of course it is. It's better than being dead. And if the person's alive, they have a chance to hear the message. They have a chance to see the hope. They have a chance to learn about recovery. So I come back to the statement, everything's not for everyone.
Yeah.
But recovery is for every addict.
Yep.
Recovery is for absolutely every addict out there. And it's hard for everyone, because what we want to do is we want to relate things back to our personal experience. Even with the critics of marijuana, the first thing they always say to me is, well, back when I was smoking weed. And I say, yes, but this isn't back when you were smoking weed. When you were smoking weed, you were buying it from a drug dealer with the intent of getting high. Okay?
Yep.
And yes, Suboxone wasn't right for this person or for that person, but for me, it's a part of my story. I was on Suboxone for 9.5 years, and you can look at it from two sides. You can say, well, from one side, yeah, it kept you sick, and your body never got a chance to neurologically heal. So over those 9.5 years, you kept relapsing and going back and forth to heroin because your body never got a chance to neurologically heal and get the separation from the opioids. Or you can look at it and say, you're right. This Suboxone kept you alive, and being on the Suboxone is what kept you from having these short periods of clean time followed up by a heavy relapse, which ultimately leads to an overdose. So,
Fuck, man. We lost him again. Shit. I wonder if he can hear us. Can you hear
yeah,
me?
is you there?
Can you hear me? Oh my gosh.
Yeah,
All right.
no, I got you now. I figured out what it is. Every time I'm getting a call here, I have to ignore it. So what I was talking about is, the perspective change and how you can look at, somebody using a different substance and on their path to recovery. And, how you could look at the Suboxone usage as it kept me alive, or you can look at the Suboxone usage as it kept me sick.
Right.
I like to look at it as it kept me alive. I have some friends right now that should never have been on Suboxone and are stuck in a repeat cycle of relapse because their body is still dependent upon an opioid. And I have a few friends, God rest their soul, who are no longer with us that would have greatly benefited from being on a methadone or a Suboxone maintenance program. So I don't really have a clear answer. Besides the fact that I respect all paths to recovery. Are you using a substance or are you abusing a substance?
Yep.
Are you taking it because you need it? Or are you taking it because you're avoiding being clean? Are you avoiding the symptoms that come from discontinuing the medication?
Yep. Right.
Yeah,
Yep.
so I do agree. I'm going to try not to let the conspiracy theorist in me out and talk about all the big pharma creating the solution to the problem they created. But I do understand, and I do see that as an issue, and I can understand why you do the same on that.
Yeah.
So I do identify with that.
Yeah, for sure. Well, oh my gosh, Adam, tell people again where they can find out more information about your treatment center, website, social media handles, the like, and I'm going to pitch it back to you. Any final messages you want to leave with our listeners?
All right, so again, guys, Road to Recovery Treatment Center. My name is Adam Lundquist. You can call anytime and get a hold of me, 877-420-ROAD. You can check out our website at roadtorecoverytreatmentcenter.com. I know that's a long one, but it's worth a search. And we're always here available to talk and help the next addict. So look forward to hearing from everybody. And I just want to take a minute and say I appreciate and respect what you're doing here and helping to break the stigma, both of you. Liz, you've been one of the biggest supporters that I've had that started as a friend in recovery and has truly helped up my confidence and what I'm doing here, and just been a true loyal friend and supporter. I want to thank you very much for that. Meg, what you're doing to help break the stigma is absolutely amazing. And on one last thought before we end this, I need to say, for me personally, medical marijuana has made all the difference, but there's absolutely no replacement and nothing second to having a relationship with God, having Jesus Christ in my life. That is my ultimate salvation, redemption, and where I find my purpose. And it's by His grace that I'm here, and it's by His grace that this plant is here, and we have the ability to talk about it. So I thank you all so much.
Oh my gosh, fantastic. I could not have said it better myself. That was beautiful. Adam, thank you so much. Liz, I'm so happy that you connected us. This has just been an absolute blessing. I think I'm going to go out on a limb here and say hands down best episode we've done yet. Facts. Facts.
Well, thank you.
The
I
synergy
learned
was
so
just
much,
so
and
right.
it's so amazing to hear about all the different things you guys are doing down there.
Yep.
And just the out-of-box thinking,
Yep.
and really getting down to the root causes of what is happening in our bodies before anything, like from the processed foods to the lack of nutrients.
Yep.
And really just pinpointing those things and helping others to realize their own potential. So thank you so much, Adam. and I will always support you.
Thank you.
Oh
Thank
my
you.
gosh, you guys are amazing. I'm gonna shut. My heart is like pumping with love right now. I'm just loving this. Adam, thank you so much for taking the time. Without question, I'm gonna be sending any patients that are interested in this or any clients that I work with. I'm gonna be referring to you all the time now.
Well, thank you so much. And if you guys ever want to have a conversation again, I'm always open for it.
All right, I love it. Thank you so much, Adam. Have a great night. Have a great weekend.
You too.
All right, bye.
With somebody like you, I try to follow the rules and even study for school. But now I'm falling for your cheap tricks. You like my cheap fix? I'll give you anything you want. Just take me higher than a G6. We spending time and I'm becoming attached to the fact you got my back no matter what's in our path. Maybe it's madness. There's no chance of breaking this habit. You take away all the feelings that just make me feel average. I'm an addict for your love. Don't ask me what it does, but I want you in my veins. Shit, you practically my blood. Ask if she loves me, but she doesn't reply. Feeling sick, wanting to die, and I'm still wondering why.
Well, I told myself